We will talk about important findings in urine analysis. Via urine analysis, we can detect many diseases such as diabetes, infections, liver problems, kidney disease, and sometimes we can detect them in their early stages before symptoms appear. First, we pay attention visual examination of urine. Urine normally should be pale to yellow. Sometimes it's amber to honey. It means inadequate hydration. It means person needs to drink more water. Sometimes urine is orange. Orange color indicates liver problems, but in some cases person can eat highly pigmented foods, dark foods, and urine can be colored in orange. When urine is pink to reddish, it indicates blood in the urine. Blood is in the urine when there is infection, such as urinary tract infection or kidney disease, sometimes tumors. But when person eats pigmented foods, it can also color urine to reddish or pinkish. Another important characteristic of visual examination is clarity. Normally, urine should be clear. If it's cloudy, there can be pus in the urine. Pus means kidney infection. There can be crystals in the urine. Also, it indicates kidney stones, and if there's proteins, then it means kidney damage. And when urine is foamy, it means proteins in the urine, and proteins in the urine means kidney disease also. But sometimes urine is foamy and it's not problem. If there is small amount of foam in the urine, it's not problem. Usually it may mean just person urinate on strong stream. It also causes foamy urine. But if there is significant amount of foams in the urine, it indicates proteins in the urine and kidney problems. After visual examination, we check urine chemically. Chemical examination is called dipstick examination, and first important characteristic is urine pH. Urine pH means we determine if urine is acidic or alkaline. If it's acidic or less than 5, it means that person eats high in protein and low in vegetable. So urine becomes acidic when person eats lots of proteins and low in vegetable, and it increases risk of kidney stones. Normal pH is between 5.5 to 6.5, and if it's alkaline or more than 7, it means that person eats lots of the vegetables and citrus fruits, and it increases risk of kidney stones also. So acidic urine and alkaline urine both increases risk of kidney stones. And if person's urine is more than 8, it means very alkaline. It indicates urinary tract infections because some bacteria contains urease, and this urease enzyme makes urine more alkaline. Now, if in the urine there is proteins means kidney damage in many cases. It can be because of urinary tract infection or diabetes or high blood pressure or kidney disease. So protein in the urine should not be presented in normal cases, or it can be minimally. Sometimes if person after viral infection, for example after common cold and flu, there can be protein in the urine, but in most cases it defines kidney problems and kidney disease. Glucose in the urine should not be presented in normally, and if it's presented, it means diabetes mellitus in many cases. Ketones in the urine also means uncontrolled diabetes or prolonged fasting or high-fat diet, which is called ketogenic diet, or prolonged exercise. So ketones is product of ketone formation, and ketones are produced by liver from fats. And when person is on fasting, then ketosis is promoted and ketosis is created, and that's why we have ketones in the urine. When person is on ketogenic diet or person intakes only fats and proteins, then still we have ketones in the urine. And if there is uncontrolled diabetes, we have ketones in the urine. Bilirubin also should not be presented in the urine, and if it is in the urine, it means liver disease such as hepatitis or biliary obstruction, or sometimes hemolytic anemia also. And nitrates should not be presented in normally also, but if they are presented, then it can indicate bacterial infection, because some bacteria creates these nitrates. And specific gravity means how concentrated is urine. If urine is very concentrated, it can be because of dehydration, because of high glucose level, because of diabetes insipidus. If concentration is low, it can be because of intake lots of water, or sometimes even diabetes insipidus also, if person drinks lots of water, as this case. And we have certain types of analysis. It is called microscopic analysis. So we had first is visual examination, second is chemical examination, and third is microscopic analysis. We examine urine under microscope. For example, if we find red blood cells which normally should be absent, it can indicate kidney stones, infection, tumor, or kidney disease. White blood cells means infection or inflammation. And we also search casts. Casts are parts of different types of cells which are produced in the kidney, and if there is red blood cell cast, it means bleeding. If we have white blood cell cast, it means inflammation or infection. If we have epithelial cast, it means kidney damage. If we have waxy cast, it means severe kidney damage. And if we have fatty cast, it means nephrotic syndrome. And also we search for crystals. If there is calcium oxalate crystals, it means kidney stone. If there is uric acid crystals, it means gout. And if we have white crystals, it means urinary tract infection. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.